The McMaster Pain Assistant, or MPA, is a clinical decision support system with a suite of tools designed for the OSCAR open source electronic medical record. This video will introduce the Low Back Pain Encounter Guide, a component of the McMaster Pain Assistant. Here we are starting with Ms. Acton's open chart with the user interface from OSCAR version 2014. Within the chart, we are able to open the health tracker It provides customized lists of measurements and tools for a variety of chronic conditions. Once Health Tracker is open, we can see which chronic conditions have already been registered for Ms. Acton, in this case diabetes, chronic kidney disease, and the periodic health visit, which is present all the time. In the menu on the right, we will find pain. Clicking on it prompts us to consider putting a pain condition in the disease registry, which will help for quality improvement and disease management initiatives. We can use the tools without this step by clicking on Skip at the bottom right, but in this case we will accept the prompt and select Back Disorder. What we see here on the left is the tracker portion of the Pain Assistant. This keeps track of all numerical data that may be useful for assessing and monitoring related to pain. On the right is our toolkit. Clicking on Templates provides fresh, unused forms. The encounter guides assist with a pain visit, providing help with assessment, diagnosis, decisions on management, and information for a clinician and patient. Let's open the Low Back Pain Encounter Guide. The evidence-based content of this guide is drawn from Toward Optimized Practice initiative in Alberta and from the Clinically Organized Relevant Exam, or CORE tool of Ontario's low back pain strategy. The MPA has not created any new material, it has simply assembled existing material from reputable sources in a way that fits well with the workflow of an interprofessional primary care clinic. You will notice first that the design of the encounter guide will fit a variety of displays, including smartphones and tablets. Also, the guide has easy-to-find collapsed sections that can be used in part or in whole as appropriate for the visit. Each section can be opened and closed again as needed. You may wish to use the encounter guide only for its advice about treatment or for the short in-the-moment videos that have been recorded by Dr. Hamilton Hall to support your patient education and some of the tougher messages to get across. Starting at the top, you have a space to write free text about this patient's situation. We can choose whether this is acute or chronic pain, and we can begin to assess the pain situation through a variety of methods. We may wish to identify red flags. For every section, there is some information which helps to explain why this is important and what it might mean. And at another level, even more detail, along with the source and the evidence that supports this. This allows a clinician to choose the level that they wish to be using the encounter guide, depending on their interest and level of expertise. There is an area for defining red flags, for identifying pain mechanism, for physical exam, and for identifying the pain pattern. At the top is a link to the Toward Optimized Practice video explaining a 3-minute primary care low back pain examination. There are also some tools to assess chronicity, including yellow flags and the Keel Start Back screening tool. When a tool like this or a questionnaire is embedded within the McMaster Pain Assistant, it will score the questionnaire automatically, provide an explanation for what this score means and how to interpret it, and finally we'll give references for where this was found. The score will then be entered into the tracker section that we saw earlier, and the left of the health tracker, and can be graphed and presented to the patient over time for trends. Finally, we start to look at areas related to management, including diagnostic imaging, some of the criteria, and again, more detail about how to use diagnostic imaging in an evidence-based manner. There is a video by Dr. Hamilton Hall explaining what a patient should consider when they're wondering about having diagnostic imaging for their back. Each of these short in-the-moment videos is 2 to 3 minutes in length so that it can be used during a clinical encounter. At the end, we may wish to summarize the assessment and any advice that we're going to be giving the patient. Again, we have 2 more videos, one on why it's important to stay active and one on when a referral to a back surgeon would be appropriate. And finally, some recommendations on treatment. You can open the analgesic section and see the information about pharmacology. Finally, we may wish to write out a management plan, provide advice specifically for chronic pain, and again, further resources that may be valuable to both the clinician and to the patient. This form in its entirety, whatever has been used, can be saved. It will then be kept in the completed section and will also show in the progress notes that it has been completed. Thus, this can be the complete progress note with nothing else needing to be entered into the chart. It can also be printed to give to the patient or to attach to consultations or other types of communication with insurance companies and WSIB. That ends our short introduction to the Low Back Pain Encounter Guide.